Hi, everybody. Welcome to Cox Connections. Brad Grundmeyer, Director of Public and Government Affairs for Cox, Louisiana. Thank you so much for tuning into our show. In this segment, our great friends at People's Health have asked Dr. Neil Baum, a urologist in the greater New Orleans area, to talk about a really important issue, which is urinary incontinence. And Dr. Neil, thank you so much for coming by.
Thank you for having me,
Glad
Brad.
to have you here, sir. And I think this is important for seniors, or really for all people, because, when we talk about the bladder and talk about urinary issues, urinary incontinence might be something that people might not know about.
Well, let me begin by defining it, so make sure
Please.
all of our viewers are on the same page
Yes,
with
sir.
us. Incontinence, urinary incontinence, is the loss of urine without the owner's permission. It affects probably 13 or 14 million American men and women. Now, it is common in older individuals, but it is not a necessary consequence of the aging process. So I don't want people to go away and think that it only impacts seniors. It impacts much younger people as well, and it is a problem that affects their whole lives. People become prisoners of the restroom. They're afraid to go out. They're afraid to socialize. They're afraid to have interaction with others. They become reclusive. They become depressed. It's not a killer like cancer or heart disease. It just wrecks your life when you have this.
And that's so unfortunate to hear. And I'm sure people who are watching are then saying, so what are the symptoms of it, of urinary incontinence?
Well, the symptoms are basically the loss of urine without the owner's permission, but it's going to the bathroom frequently, having the urge to go to the bathroom and can't reach the toilet in a timely fashion. It is dribbling after urination, or in the worst situation is that they have to wear a diaper, or depends. And can you imagine how discouraging it is for someone to go to the grocery store, the convenience store, and have to put a package of Depends in their cart?
God bless.
It's something that you think of.
It's mortifying, I'm sure.
Well, it's something that you think of that toddlers use, when they're, very tiny, before they become toilet trained, and you couldn't imagine that at the end of your life, you're back in diapers or Depends again. So it's a cause of depression, as well as all these other inconveniences that can happen to someone who is affected by urinary incontinence.
Well, let's talk about what are healthy practices, healthy urinary practices.
Well, healthy urinary practices mean, recognize when you have to go to the restroom. Don't hold it for long periods of time. We used to call that, years ago, secretary's bladder, where women were forced in the workplace not to be able to go to the restroom until the lunch hour. Now it's illegal to prevent them from doing that. So go to the bathroom when your bladder calls. The second thing is to drink plenty of fluids. And one of the ways that I tell people, a good rule of thumb, is to drink enough fluids that when you are outside or exercising, that the urine is white or light yellow. If your urine is dark yellow, that means you're dehydrated, and you can get sick. In our community, with this amount of temperature and humidity,
without a doubt,
they can get sick. So go to the bathroom when you have to go. Drink enough water till the urine becomes very light colored. Is a healthy habit to have.
You were talking about urinary incontinence. The causes, I would think, is a weak bladder?
Well, it's due to the fact that the bladder can hold less fluid, or that the opening, as in women, loses its resistance, and women lose the urine when they cough or sneeze. And that's called stress urinary incontinence. And it's not emotional stress, although it causes emotional stress. It is the stress of coughing, laughing, exercise, that when you increase the pressure in the abdomen, it pushes on the bladder, causing a squirt of urine to come out each time they laugh, cough, or sneeze.
And there's three others: urge, overflow, and functional.
Urge is when you have to go right away. You hear it on TV, when you gotta go, you gotta go. That's urge incontinence. Overflow is usually something that happens to men. Men have a blockage of the prostate gland. As they get older, the prostate gland grows and it compresses the urethra, and they can't go to the bathroom, and so the urine kind of overflows. It's like it's a barrel of water, and you keep adding water, it just dribbles over the top.
Right.
And these men are constantly dribbling. And functional incontinence is that condition where people have impairment, that they may be not able to perceive the sensation that they have to urinate, or that they can't reach the restroom in time, that they're severely arthritic, or they have a walker and they can't get to the bathroom in time. And that's the source of falls and fractures. So urinary incontinence is not only does it impact your quality of life, if you have urgency and you have to get to the bathroom right away and you can't reach it and you fall, and the likelihood of fracturing your hip means that you are going to have months of rehabilitation, and those people that have that have increased risk of mortality, because if you're older and fracture your hip, that is not just a simple benign condition.
Sure. Now, I'm sure being a urologist, the question is, what can you as a urologist do to help people who have this?
Well, we start by simple things first. Teaching people how to train their bladder to hold more fluid, teaching people exercises. They're called Kegel exercises. These are exercises that women can do that can strengthen the muscles in the pelvis to prevent them from losing urine when they cough or sneeze. And then we can send them for physical therapy so they can rehabilitate the pelvic muscles to be able to help them to hold more urine. And then after, that's what we call first-line treatment.
Right.
Second-line treatment is medication. There's about 7 or 8 medications and gels and patches that people can use to help the bladder capacity increase. And then when that doesn't work, then there are surgical procedures that can help these women, to help them restore their continence, to put their lives back in order.
It's because, when you're talking about behavioral techniques and physical therapy, people need to know that there are options.
Yeah, it's not just you start with surgery.
Right.
That's the last thing that you do. You start with the simple things. Teaching people, look, you're holding the urine only 45 minutes and you have to go again. Let's try to go to 55 minutes.
Stretch that. Yes.
Right.
Slowly but gradually.
Yes.
You can do that.
And to give them ownership of the problem, that they can help themselves.
That's a beautiful thing. And the nice part about it is, to your point, they don't have to immediately think, oh, well, I'm going to have to go into some form of surgery or outpatient procedure. Come to a urologist, learn about what can be done in the simplest forms. Have your ownership, like you mentioned, Dr. Neal, and then go through other steps that might eventually lead to, but we don't want to get to that point just yet.
Right. Don't think that surgery is the only option. There are many, many other things that can be done that can help men and women so they don't have to suffer the embarrassment of incontinence.
Well, I can't thank you enough, Dr. Baum, for coming by today. Great information. I think it's important for our viewers to know that there's help out there for urinary incontinence. And if anyone's interested, of course, we can go to our great friends at People's Health's website at peopleshealth.com. And there's a number, as well as you can call, you can at least go to medicare.gov for more information, or call 1-800-633-4227 for more information. Again, go to the peopleshealth.com website and click on the My Health tab to find out more information. And I can't thank you, Dr. Baum, enough for coming by today.
Thank you for having me, Brad.
All the best to you.
Thanks so much.
All right, everybody, that wraps up this segment of Cox Connections. We'll see you next time. Thanks for watching.